Good morning and welcome to this introductory sessions on Principle of Biostatistics. My name is Claire Choo. It is indeed my pleasure to present you this lecture today. Today's sessions will be divided into three main parts. As this is an introductory session, our primary focus would be introducing basic concepts and terminologies commonly used in statistics and its application without delving into mathematical functions. We would first talk about what is statistics and what role does statistics has in health. It is important that you appreciate the value of statistics and how it has helped to improve the health of the population. In the second part, we would talk about data because this is what we deal with in statistics. We will introduce you the concepts of population and samples and also different types of data that we collect. We'll be working with you on two types of data, that is, quantitative and qualitative data. Following this, in the final part, we would consider the different ways in which we can learn from the data. We will start out descriptively, and this will follow by making a statistical inference. The emphasis in this part is on learning how to draw conclusions about population with the help of data derived from a sample. Let us then begin by examining what is statistics. Today, our society is completely taken over by data. Data appears in everywhere you look. It could be an article focusing on crime rates, or health facts telling us the demographic of population such as maternal or child death for the year, or information about commodity such as palm oil, or the latest price of goods and services in the country. We often call statistics as the science of learning from the data. It refers to both the numbers that describe the characteristic of population and the science that help to interpret this number. The science of statistics has a set of concepts and methods used to analyze data, therefore making it possible for us to translate data into useful information that help us to advance our scientific understanding. Statistics has become an important tool in the work of many disciplines such as education, sociology, engineering, medicine, including public health, just to name a few. Now that we know what is statistics, the next thing we would like to know would be what is public health. According to the World Health Organization, public health defines as all organized measures or activity to prevent disease, promote health, and increase life expectancy among the population. These measures could either be initiated by the public or private sector. All public health activities aim to provide condition or livable environment in which people can be healthy and be productive. Most importantly, public health focuses on the entire population, not just on individual patients or diseases. One might wonder whether the use of statistics has really made our life anywhere better. One way to illustrate the breadth on how statistics has transformed public health is to look at some notable public health achievements for the past few decades. The United States Center for Disease Control, or the CDC, has previously published a series of reports on the 10 great public health achievements in the 20th century. This report had reminded us what public health is and how statistics contributed through a historical lens. These extraordinary achievements include, for example, immunizations prevented child death and morbidities, control of infectious disease, declines in death from heart disease and stroke, and now we recognize tobacco as a major cause of death, and many other examples as you can see from this slide. Many of these public health achievements will not be possible without information obtained from statistical analysis of data combined with the use of techniques developed for decades, such as clinical trials, epidemiological methods, and laboratory science, which led to our understanding of etiology of diseases and how to prevent these diseases. One particular example is a Framingham Heart Study, which has provided us a wealth of information on the risk factor of heart disease. The study started as early as 1948 and stretches beyond the third generation by now. A large group of men and women in the community who initially had no cardiovascular disease or CVD was involved in this study. In the study, the researchers gathered observational data through physical examination, interviewing about their lifestyle, and conducted surveillance of hospitalization. Using a cohort study, these men and women were followed up for the development of CVD. As a result of this study, with the use of statistical analysis, it has provided us evidence identifying many risk factors of CVD, including high blood pressure, high cholesterol, smoking, obesity, diabetes, and physical inactivity. Other contributions of how statistics has improved public health include we now can understand people's access to health services and the use of preventive services by looking or analyzing descriptive data of how people use these services, when they use it, and whether its use has been distributed equitably across the population. Indeed, the contribution of statistics in public health has much more than what we could imagine. Now that we know what is statistics and public health, and understanding the value of statistics in public health, this concludes the first part of this lecture.